Hello, my name is Nicolosi, and today I'm going to be talking about Fragile X syndrome and exercise. More specifically, what exactly Fragile X syndrome is, some components of Fragile X syndrome, and how exercise can be a great treatment for this disease. So for the epidemiology, in 2004, the CDC reported that 1 in 7,000 males and about 1 in 11,000 females have been diagnosed with Fragile X syndrome. Fragile X syndrome is the most common known genetic cause of autism spectrum disorder and has been associated with other neurologic and psychiatric disorders. For the pathophysiology, Fragile X syndrome is a genetic intellectual disability. It is the most common cause of intellectual disabilities, and it results from a change in a specific gene on the X chromosome, hence the name Fragile X syndrome. This gene is called FMR1. And in a typical FMR1 gene, it makes essential proteins that are important for neurological development. But with individuals with Fragile X syndrome, it either makes not enough of this protein or none at all. And this protein is called FMRP. Now, there are certain physical characteristics that come with Fragile X syndrome, and these include having a long face, large ears, a prominent forehead, and other symptoms include flexible or weak muscles, flat feet, low levels of coordination, cardiac defects. About 10% of individuals with Fragile X syndrome have seizures, and another common symptom of Fragile X syndrome is anxiety. Now, everyone can benefit from exercise, including individuals with Fragile X syndrome. It can alleviate several of the symptoms that I mentioned on the previous slide, such as strengthening those weaker muscles and improvement in their low coordination. It can improve motor and sensory function, and there are endless mental health benefits to exercise. Because it is an intellectual disability, it's important to pay attention to those neurological aspects of this. Exercise can reduce anxiety, it can improve focus, it can activate neuroactivity such as neural transmission and neural growth. And in my opinion, the mental health benefits outweigh the physical health benefits because it is an intellectual disability and it affects the brain so much. Now, how does Fragile X syndrome affect the exercise response? Exercise requires focus and attention. So individuals with Fragile X syndrome are commonly known to get distracted by their surroundings, and they could also become anxious because of their environmental factors and their environment. So it's important to remember that you won't always have their attention. This disability affects balance and coordination. It affects muscle integrity and cardiac defects and other atypicalities. In 2012, a study was done assessing the vagal tone and interbeat interval in boys with either Fragile X syndrome or autism spectrum disorder, or both, or none at all. And it has been shown that there were abnormalities when the sympathetic nervous system was aroused in the atypical subjects. So as you can see by this chart, so TD stands for typical development. So you can see that there was differences there. And this has been theorized that it is due to the lack of the FMR1 protein. Now, certain modifications must be made. It's important that it is carefully monitored because individuals with FXS have low muscle tone and coordination, and it is important that modifications need to be made. So for example, because of their weak muscle tone, if you typically use a medicine ball with a client, you would use a lighter weight ball. It's important that you pay attention to your environment. Typically, individuals with Fragile X syndrome do not like loud noises and they do not like crowded environments. So a crowded gym might not be the best environment for an individual with Fragile X syndrome. It's of course important to pay attention to medication and syndrome side effects and symptoms. It's important to know if they need either just a break or if they need medical attention. And it's very important that you know the side effects of all medications that they're on and any symptoms that they may have. So some common medications that individuals with Fragile X syndrome could be on, as I said before, individuals with Fragile X syndrome are known to have anxiety, so they could be on an anxiety medication or an antidepressant. Um, it has been shown that people with Fragile X are very aggressive, so they could be on a medication that could alleviate aggression. An attention deficit or hyperactivity disorder medication, repetitive or perturbative behavior medication, and it's also known that individuals with FXS have abnormal sleep patterns, so um, a sleep medication could also be given. And again, it's very important to know the side effects of these medications before you proceed with an exercise program. So now we're going to look at a case study. Austin is a 17-year-old boy that was born with FXS. He has been going to physical therapy, occupational therapy, speech therapy, and behavioral therapy since he was little, but his parents would like him to incorporate more vigorous exercises into his daily life. He is seeking certain exercises that will challenge his mental and physical capacities while simultaneously not overwhelming him. Austin has been cleared for exercise by his doctor. Austin is currently on an antidepressant called sertraline and takes melatonin as a sleep aid. He is 5 feet 7 inches and weighs 156 pounds or 70.8 kilograms. He dislikes loud, sudden noises and enjoys being outside. Now, prior to the actual program, we need to do some exercise testing. So individuals that are adolescents or children, cycle ergometers and treadmills are most appropriate for exercise testing. And of course, you want to do something to assess his body and his body composition. So I will record his BMI. For cardiovascular endurance testing, I will do the 1 mile walk test on a treadmill. Because of the cardiovascular atypicalities that can occur with individuals with Fragile X, I'm not doing anything too vigorous. I will not require him to run or sprint. It's just a nice, simple walk. For flexibility test, I thought the sit and reach was appropriate. Just a simple sit and reach test. It's moderate intensity. And he would just stretch until he felt a certain tension in his lower body. For resistance training, it's very important that you don't do anything too vigorous because of that low muscle tone. So for resistance exercise testing in resistance training, I prescribed a modified pull-up test. Now for the actual exercise prescription, although children are recommended to get 60 minutes of moderate to vigorous physical activity daily, I will only meet with him 4 days per week. So for cardiovascular endurance, he will do this about 2 to 3 days per week for about 30 minutes per session. He will start with a 15-minute walk outside. And as the program progresses, I will add a weighted vest to put some weight on his body so he can develop some muscle tone in his upper body. I will also prescribe 10 jumping jacks, 10 butt kicks, and 10 squat jumps. And for intensity, it's about 40% of his heart rate reserve with the moderate intensity. For resistance training, I will have him do about 1 to 2 days per week for about 20 to 30 minutes per session. We will do resistance bands starting at level 1 and progress as he continues with the program. We will have 5-pound dumbbells, slowly increasing that weight of just different exercises, such as, pull-ups and different exercises with the dumbbells. And then 2 sets of 10 for those exercises at a moderate intensity. For flexibility, we are doing 2 to 3 days per week for about 20 to 30 minutes. We are focusing on yoga to promote some anxiety alleviation so he can reduce his anxiety levels. So we will do 15 yoga poses held for 10 seconds each, and he will hold the pose until he feels some slight tension, nothing too strenuous. Specific to his wants or needs, since he likes being outside, we can throw balls, incorporating sports to improve his coordination. And we can do other things outside to make sure we're incorporating his interests into the session and maintaining his focus. And often with children with disabilities, you incorporate rewards such as time on the iPad or something else that he likes to do as reward for what he is doing. So some side effects of the medication that he is on, it could cause vision changes, nausea, diarrhea, sweating. So when we're exercising, it's important to drink plenty of water. It could cause tremors, and the seizure risk is increased because individuals with Fragile X syndrome already have a risk of having a seizure. So it's important to look for the signs and symptoms of that. I also want to add that I think it's important to make exercise fun for any individual, no matter what age and no matter what population. Exercise is fun, so you want to make sure that you're incorporating what they're motivated by. So whether that's music or something else, it's important that you know what they're motivated by. The National Center for Health and Physical Activity and Disability shared a video of their personalized program with their student who has autism. And when they were doing this standing as dumbbell press, the coach asked him what song he would like to sing. So he got to do something that he wanted to do while he was performing the exercise. So I thought that was very interesting and important to include. So in conclusion, I think it's important to learn when to push your client and when to take a break, especially with children and especially children with disabilities. It can be easy to just want progression and want progress for them so badly that it can be easy to push them too hard, and that's not a good thing. So it's important to know when to take a break, when to take some breaths. It's important to be alert, know the signs and symptoms of all possibilities that could occur. And it's also important to allow opportunities to be independent. While I said previously it's important to make sure they're being monitored closely, it is also good that when you feel that they're ready to take a step to be independent, when they're ready to do an exercise on their own, it's important to allow that opportunity to occur. So thank you very much. Here are my references. Thank you.